Good afternoon. I'm going to wait a few more seconds to see if some more participants join us. Hello, I'm Brenda Metzler, a community and program support specialist with Let's Grow Kids and a member of the board of Vermont AEYC. I'll be your host this afternoon. Let's Grow Kids and the Vermont Association for the Education of Young Children welcome you to a conversation about the American Rescue Plan Act Stabilization grants. For the next hour, we will hear from several experts about potential ways to maximize the use of these grant funds in Vermont's regulated early childhood education programs, your programs. I'll begin with a brief, familiar scenario. You know when a child in your care, let's say a toddler, is having a moment, perhaps navigating a powerful emotion, and they need you? You do your best work when you can be responsive rather than reactive. When you've had time to develop your skills outside of the heat of that moment. For the last 19 months, you've been living every day with the challenges of a pandemic exponentially more intense than a toddler's struggles with big emotions. And you've rarely had the luxury of time to develop a responsive plan. It is our fervent hope that you will be able to plan well for how to best use the ARPA stabilization grants to benefit your program, to be responsive in this moment of opportunity. Today's presenters include Sherry Carlson, Chief Programs Officer at Let's Grow Kids, Lawrence Miller, Independent Consultant with Five Vine Consulting, Erika Schramm, Founder and Principal at Skylight Coaching and Consulting, and Ann Levesque, Director of Human Resources at Wake Robin. We will have a Q&A time if time allows, but it's not likely with such a panel of experts. But we do want to honor your questions, and I will explain later how we'll handle those if we don't get to Q&A. So at this time, I'm going to turn it over to Sherry to get us started.
Thank you, Brenda, and thank you to the rest of the experts that are joining us here today to talk about what we'll refer to as the ARPA stabilization grants. That's so when we're saying ARPA, that's what we're talking about. And the let's just start off by revisiting. Some of you have been taking advantage of the program that we referred to as CURSA. And that is a program that kicked off in April and it runs through December 2021. And I thought it was important to look back at the program you may be participating now. Not all programs applied for and are participating in the CURSA program. Approximately a little more than 70% participated in that program. And that is a program that ends in December. And there are some differences between the CURSA program and the ARPA program. So this slide shows you in terms of like what you can spend the funds on. So the real difference here is that ARPA dollars cannot be used for supporting reduced enrollment or lost revenue. But it can be used for mental health services, consultation for program staff and for children, which CURSA did not have that category as an approved expenditure. There's some other differences that I think are important to understand too. The CURSA program had a deadline. So everybody that was interested in applying for the CURSA dollars they applied by a certain deadline. And then the Child Development Division in the state of Vermont looked at those number of applications and they determined a formula, and that is how the amounts were awarded. Something that's a little bit different about the federal guidelines around ARPA is that the ARPA funds need to have a rolling application process. So what this means is that the Child Development Division needs to plan for 100% of programs requesting and participating in this program. So that is, so while we all know, many of us know that the actual amount of dollars coming to Vermont for the ARPA program is more than what was available for the CURSA program, we do have to plan that not only 70% will participate in the program, but that maybe 100% will participate in the program. And you also have to allow for, if new programs open during 2022, that they have access to apply for some funds as well. So that's, I know many of you have been using the estimator tool to find out like how much you're getting, and there's some are getting more, some are getting the same, some are getting less, and part of that is there is some differences in how what was weighted in the formula, and those are spelled out in the child development FAQs. But there's also this rolling deadline that CDD needs to make sure that there is enough funds for every program that may want to apply during the life of the program. So while there's more money, who it's being divided among could be much greater than was what happened with the CURSA funding. So a couple of tips I just want to share around that is that if you apply soon, the intention of the Child Development Division is to start payments at the end of November. So for those of you who may be seeing a little bit less, you do receive CURSA through the end of the year. And if you apply for this as well, you would be participating in 2 programs over the last few months of this year. So that might be helpful in thinking about how the funds you have available and how to utilize them. So this is the ARPA plan, 29.3 million in funds. There is, a 10% administration fee that goes to the state of Vermont, but the rest of the funds have to go directly to programs. And then there's also some discretionary funds and some other funding in that plan, in that act, that aren't relevant to the conversation that we're having today, but that is the entire package that I wanted to show. So those of you that have read the frequently asked questions that the Child Development put out, or have been using maybe the estimator tool, this identifies, there's a base rate for all applicants, and then that base rate grows according to some of this criteria. And that is infant and toddler care, those that offer alternative shift care, programs that are going to use their award for staff compensation, programs that are working toward getting back, for programs that are not operating at pre-COVID hours and schedules, programs that are going to use funds to help get back to those pre-COVID hours. There was, programs that are where more than 18% of children are living in low-income families receive a little bit of a bump, and then programs that are racially or culturally, serving racially and culturally diverse populations also. So those are all the criteria in terms of looking at the formula and the funding that were taken into account. And before I talk about this slide, I just want to also say that there are 2 things to consider. So I talked about why the ARPA funding might be different in terms of the number of programs that we may be splitting the money with, and there is some changes in the criteria and the weighting. I also want to say that, the Child Development Division has indicated that they are fully committed to keeping an eye on this funding and seeing what's available. And as the program winds down, if there are funds that aren't being allocated, that they find ways to get every bit of funding into programs. So, this is just the start of the program. There's a lot of work to be done, but but I do believe that the Child Development Division will be making sure that all of the funds do go to programs. And so that could mean later on in the program, they're looking at making some adjustments, but we won't know that until the program is, really up and running, and we have a better understanding of the take-up rate and how many programs are utilizing the funding. This is just a quick slide about what some of the discretionary funds are allocated for, and those are funds that are not part of that that 29 million that are going to programs. I also want to mention that municipalities also, cities and towns are also receiving funding, recovery funding, and some of that funding can be used for childcare. That is an allowable use. We are working, Let's Grow Kids is working with the Vermont League of Cities and Towns to put together a webinar for leaders of cities and towns to understand that that is an allowable use, and why they may want to allocate some funds that way, and what ways they might want to allocate some of those funds. We also will be sending out a resource we put together that just gives information. So if you want to write to your or meet with your local town and government, your town government leadership, you might have some talking points that you can use on that. But this is another, outside of the ARPA funds that we're talking about today, this is another resource that may be available in communities to support childcare. And that's just a little snapshot of the ARPA grant program. And now I'm going to turn it over to Lawrence Miller.
Good afternoon. My name is Lawrence Miller, and I'm seeing a lot of familiar names in the attendee list. Good to see you all again. For those of you who don't know me, I do a range of advisory work for businesses and organizations, and I was Secretary of Commerce and Community Development and Chief of Health Reform. So I've spent a lot of time on the government and policy side of things. So that's my perspective as we come to this. Next slide, please.
Oh,
We'll work. We're doing this without a lot of practice, so.
Lawrence, it's not moving forward.
Ah.
Oh, maybe. Okay.
There we go.
There we go. I'll do it that way.
So my area of today's conversation is really about how to think about ways to use this money. And I will tell you that I'm coming at this with a filter of having been working with a lot of organizations through the pandemic, that when we talk about stabilization, we've got some near-term ideas, but this is also about how do we come out of this event stronger. And so I'm going to be encouraging some thoughts about how this will lead your program to be in a better place, not just while this funding is available, but afterwards. So the purposes are to cover unexpected business costs associated with the pandemic, but also stabilize operations so you can continue providing care. And I'm taking a long-term view of that part of the purpose. Next slide. The allowed uses that we've identified in this are personnel costs, rent, personal protective equipment and such. Other equipment and supplies to respond to the COVID-19 public health emergency, and we're using that term broadly, not noting that the state's declaration of emergency has passed. Goods and services necessary to maintain or resume child care services, and importantly, mental health support for children, families, and employees. This one, I think, deserves a particular moment. We have some employees who, as has been mentioned, are really stretched to the max. So give some thought to how this might make a difference for being able to help people get through the winter. Next slide. There are some limits that I think are really important to keep in mind. First of all, property taxes, business taxes, these are not allowed uses under this unless your mortgage payment includes an escrow for property taxes. So just keep that in mind. You're going to use other money for that. Also, major renovations the purchase of improvement of land are not allowable expenses. So when we say major structural changes, big stuff, you're really limited in this more to what you would be fit up if you were a tenant. You can't change the function of the purpose of the building. If you are simply extending some uses, I think you're going to find that that's allowed. Next slide. Another important limit to keep in mind is this is not tax-free money. This is taxable income, and you just need to keep your planning in mind. So talk to your accountant about what you need to set aside as this money comes in, the same way you have with some of the other funding that's come into you. Next slide. That being said, those things that you can't use money on, fungible is fun. You can use this money for allowed uses, freeing up money that you might have spent on those allowed uses for unallowed uses. That's the great thing here. And the key here is having the appropriate documentation. So we want you to keep all your receipts for the allowed uses, payroll statements, whatever documents your use of this money, how you chose to elect it, to use it, and keep those receipts for 5 years. I recommend a simple paper file for that, and just be really clear. US is also where you want to avoid duplication of benefits. You're not using the same receipt for this money and other supporting money. This is particularly important in December when you might get your first slug while you've still got other funding sources. The other thing is you can use these on some expenses that already happened. If you're going to assign this funding to those sources, you may also be able to free up some money you've already spent for other uses. I think this is a question of documentation and being really clear. Your reports are correct and your analysis is going to support an audit. And that's how I would approach it. You're not going to need to turn these receipts in. You need to have them available if you're audited. Next slide. So there's the list of what they say you can use the money on. Let's focus on your priorities. This could be a lot of money for some programs. It's not necessarily going to be a big change if you've been enrolled in the other program to date. But it's still could be a good chunk of dough if you're not thinking about it as just supporting daily operations. If it is needed to just support daily operations, I'm really encouraging you to use this time period over the next year to think differently about what changes your business needs to be making to be ready for the expiration of these funding supports. We don't necessarily expect something to come in behind this. So this is transformational time. One of the nice things about this money is you don't need to use it in the same month received. Again, we're not matching this. You're not putting in reimbursement requests, but you do need to get the money out the door by the end of next year. For those of you who were with us last year for some of these webinars, the next little bit is going to be familiar. I just want to revisit it briefly. The whole idea of keeping an idea of the risk log, vision for the future, and an opportunity log, and putting those to use as you consider how to use this money. As a refresher, the risks area, this is about getting risks and worries out of your brain and into writing. This is not a Zen mastery approach of freeing yourself from worry. This is about documenting worry and getting it out on your brain. It's a living document. Likelihood and consequence, business and personal, just so that you can free up space in your brain. There might be some risks that you identify in this process that you do want to spend some money on. In particular, there's some life safety and property safety allowed uses in this funding to improve plumbing, to improve electrical, get GFI outlets where they need to be if they aren't already, repainting where there's toxic paint, some stuff like that. So those might be things on your risk list that you want to address with this money, but I'm really more excited about the opportunity list. Next slide. And this is where we want you to think about what is your business future? What's your program future? This has been a big event. We're all finding our priorities and values are shifting, and intentionality is important. So this question of aspirational attributes of your program, what do you want it to look like when we're all done with this? What do you wish was different about your business, your life, your relationships, and what inner truths and beliefs are changing? This sounds a little woo-woo to some people, but we're talking about deploying some real resources that could form transformation, and being intentional, I think, has a lot of value. Next slide. So that is your opportunity list. Opportunities to me are external, but they're things you can influence. And so you get ready for that, and you score these again similarly. And then you figure out what's likely to happen, what's most possible, and what's got the greatest consequence, and you focus on that. Next slide. To me, that significance is the most important variable. What's going to have the most significant impact on your capacity for the future? And what does stabilization mean for your particular program in the long term? And this is a defined set of resources. What are the other resources that you're going to need to make it possible? ARPA is one tool. You're going to be using all the tools to get through this period and emerge most successfully. Next slide. So we can go into some of the allowed uses. I think, and you'll hear this from a couple of other folks on this call, people is your most important resource. And you've got allowed uses for employee recruitment and retention, professional development for licensing requirements, and that includes paying subs while you've got people who are out getting trained so that you don't have to bootstrap all that time. Professional development on social emotional curriculum, trauma-related books, materials that can be durable, but that training is the most durable thing, right? That stays with your employees and with you, whatever else happens, and you continue to be able to bring that to the field. Professional development and training related to health and safety practices as well, and childcare after school costs for employee children, which frees up those people to be a little less stressed and more present. Next slide. There's areas around the children's play opportunities that are specifically called out in the allowed uses. Play and or health and safety materials, improving internal play space, improving outdoor spaces, expanding gathering spaces. Again, this hits the limit of what's major reconstruction of your property, but things like moving temporary walls, non-load bearing walls coming out, moving a fence, expanding a fence. These wouldn't be major, these would be minor. So as you look at your space and think, wouldn't it be great if, these are the things that you might draw inspiration from. Next slide. And then physical improvements that are relatively modest. Although anybody who's done cabinet work in a kitchen or replaced a bathroom and all the fixtures know that repair and maintenance can get really expensive really quickly. Room dividers, I mentioned non-load bearing walls, installation of rails and ramps to increase accessibility for individuals with disabilities and expand who your program can serve. This is fantastic. Windows and doors, energy efficiency, all of these things, you know, replacing all the electrical fixtures with energy efficient fixtures, accessing energy efficiency dollars. In addition to this, this could reduce your electric bill long-term, improving the long-term sustainability of your program. When in doubt, DCF has a email address to get clarity. You can talk to us, and you can go to them directly if you're on the edge about whether or not something could be subject to recapture and you want to avoid that risk. Sending an email, getting that back, printing it, and putting it in the file with the receipts will help you if you've got anything that you feel might be on the line. Better to be prudent. Next slide. So to wrap up my section, this can feel really limiting, especially when you're filling out the estimated benefit form and you get back a number that doesn't feel a lot different than your current cash flow. And a lot of people are experiencing that. I want to encourage you to really still pull back and think about how that money is extra on top of what baseline would be. And that can feel really difficult right now, but I think it's very important to really pull back. We talk about time spent working on the business instead of in the business. Grab that list, go for a walk, do it at home, do it somewhere you can feel creative, but really get yourself into a different place. Focus on your vision of the future of your program and what your families and kiddos need. This is a government program. It's necessarily got some guidelines and restrictions. How do those best fit your vision is the question I want you to be asking. So don't limit your imagination to the list. Use that list of inspiration for what works for you, and consider what other resources you need to support your plan. I think it's really important to pause. We're all exhausted. I don't know, maybe not all of us. I certainly am. I feels like the last 19 months have been years and years and years. And that the time we spent together early last year is such a long time ago. The amount of change you all have managed since last March is just extraordinary. I'm so deeply appreciative of what this group has managed to accomplish for Vermont's kids and families. It's just awesome. So pause, say, wow, if we did all that, whatever we need to do next, we can get there. We can figure this out. But part of that is going to be frustration, right? We, as I said, I spent a lot of time in state government, in some areas of government that really frustrated people. No two ways around it, right? I was involved in the helping fix the healthcare exchange. And that was brutal. And there's a lot of limits on what government can and can't do, and the processes and procedures that are required. So this provides support, but it's got its limits, and it needs your creativity and your compassion for the people at the other end of the state who are trying to deliver this as best they can within the federal requirements that are put on them. So we're all going to have some frustrations as this rolls out. Let's all work together to get this done. So I think that is what I wanted to make sure I covered, along with just being able to answer whatever questions we might be able to get to today, which won't be a lot, but we will record all the questions and we'll get your answers back in a published FAQ with follow-up, and you'll have access to this deck as well, which includes my email for any specific questions you might have for me. Thank you.
Well, thank you. Thank you, Lawrence. You gave us a lot to think about. And thanks, Let's Grow Kids, for hosting this webinar and for inviting me to participate. And above all else, thanks to all of you for doing what you do every day. As a mom of 2 boys who have been through childcare, I know how important and valuable your work is. And I know when you find a great childcare center, how it can make such a huge difference for your kids and for your family and for your whole community. So thank you so much for all that you do. And you've had probably one of the hardest years or years and a half of your lives. And your businesses have gone up and down and all around. And there's this opportunity in front of you now to continue to invest in your team, to continue to invest in your childcare program, and recognizing that the investments you make in your program now are long-term investments that will benefit the children and families that you serve. And the work you do is so important. And we know through employee engagement research that people want purpose and meaning from their work, that deriving meaning from the work you do every day helps make you feel more engaged at work. And you want to be known for what you're good at. And you are all so good at what you do. But at the same time, if your basic needs aren't met, if your staff's basic needs aren't met, then it's really challenging to come back to that purpose for why you've went into childcare in the first place. So what I want to spend a little time on is just building on the framework and some of the conversation that Lauren started, and just help you think about how you might use some of this funding to invest in yourself and to invest in the people who work for you in your programs. So let's go to the next slide. So I know as we're waiting for, there we go. Lawrence talked about keeping logs, and keeping a log in a journal and trying to really write down all of your ideas is such a great idea, because so often we have all of these ideas in our heads and then we get overwhelmed and we don't know where to begin. And so I also, in addition to what Lawrence shared, wanted to just share this really simple framework as you're thinking about how you can invest in your team. First, and at the bottom of this pyramid, there's the basic needs. How can we ensure that you and your team and your program's basic needs are fundamentally met? And so how can you invest in ensuring that any needs that are not met are able to be met? And then how can you focus on developing each individual who is part of your team, yourself included, to make sure that you are all continuing to have opportunities to learn and grow? And then collectively as a team, what can you do to make sure that your team is growing, that your team is a cohesive organization, that you have a strong culture for yourself and for the people who work with and for you? And so just to understand some options, ideas for how you can use the funding to make sure basic needs are met, pay increases. If people are not paid a fair and living wage, chances are they're not able to focus on doing their best work. So investing in people's pay is money well spent. I know health insurance is something to consider, and there's so much complexity with offering health insurance and the impact that it has on people's wages, but exploring what may be available to, if you're able to provide health insurance to your staff. Looking at time off to make sure people have time to take off if they're sick, if they want to take time off for their own personal time. If there's an opportunity to invest in someone's retirement plan, making sure that the people have a safe place to work. So knowing that you can use this funding not only on wages and benefits, but also on making sure that you have a safe place to work, to make sure that your program has the needed supplies. And I added this one at the end because it doesn't cost anything, just to make sure that your team has clear expectations. And so really taking the time not only to spend money, but also to take time to make sure that your program is being run in such a way that people know what's expected of them and that they have the tools and resources they need to do their job. So assuming people's basic needs are met, how can you focus on helping people learn and grow within their roles? And so you can invest in professional development, whether that's developing early childhood education skills, health and safety skills, supporting mental health, providing regular feedback. Once again, it doesn't cost anything to let people know where they stand and to make sure that you are recognizing people and providing feedback. Providing flexibility to your team so they can tend to their work needs as well as their personal needs. Providing your staff with retention bonuses, which is one of the criteria that are set forth in this program. And considering adding an employee assistance program so that for folks who are struggling with whether it's mental health or trying to find resources and tools to support them so that they can show up doing their best work, looking at an employee assistance program to help with that. And then at the team level, continuing to invest in professional development for your team and looking at community and team building activities, taking the time to celebrate your success, taking the time to just spend time with each other, and really making sure that your staffing levels are adequate overall, and not being afraid to invest in staffing to make sure that your team is able to operate as effectively and efficiently as it can. So we have all these ideas, and I'm sure you have many, many other ideas. So how do you even make a decision? What are the best decisions to make for your team as you're thinking about the long term? One, it's understanding your options. It's not only coming up with your list of your ideas, but it's also understanding what it takes to implement those ideas. What are the near-term costs and what are the longer-term costs? And then it's talking to your team. What's most important to them? What do they value? What are they looking for when they think about what they need to come and show up and do their best work? What's most important for them? And a tool I love to use is an effort versus impact matrix, where you can identify, let's say you have 7 different options that you can implement. What are those options that will have the biggest impact for the least amount of effort? And that's a place to start. And then really focusing on what matters most to your team. How can you balance those small and easy wins with the longer term opportunities? So you're not just investing in the long term, you're looking at how can we do something small that shows our team that we care, something small that shows that we can make a big difference, while at the same time looking at how you can invest money for the long term. And so those are just a few ideas, and I'm so excited to give you a chance to spend some time with Anne, who in her role has lived this opportunity of trying to create programs that support staff. So with that, I'll turn it over to Anne.
Thank you so much, Erika. This has been so interesting, and I'm grateful to have the opportunity to follow up from all of these different perspectives. So I'll start off a little bit by way of introduction and where I think my place might be in this conversation. So I have been working in the field of human resources for almost 30 years. I know I don't look it. And in that process, have worked with a lot of different organizations, a lot of different sizes, driven by different motivations, for-profit and nonprofit. And as I have had that privilege, I've really watched how people relate to the work that they do. Right now, I work at Wake Robin. I've been here for 15 years. Wake Robin is a large organization. We have 230 employees, which at the face of it might make you go, you know, they have resources that are different than the resources that I might have because I'm a much smaller provider. So while that may be true, I think there are places where we intersect in ways that you might not imagine. One of those is that we are actually sharing the target market that you hope to recruit in an interesting sort of way. I remember several years ago when the regulatory environment of childcare began to really change in the state of Vermont, we were able to recruit pretty heavily from childcare providers because people were beginning to shift away from that business model because they couldn't afford to do it anymore. And so they were looking to get into something else that made them feel valued, that allowed them to connect into the care economy. So I watched a number of LNAs, for example, transition from being daycare providers to actually choosing a completely different career path. While that is my short-term win, that is not a trend that I think is useful for the state of Vermont in any way, because here's how we experience it on the other side. I work with my employees constantly to be able to help them find the services that they need to allow them to continue to work full and part-time, and they need you. So it's a very interesting balance. We all live in the care economy. And what you may or may not know about the care economy in the state of Vermont is that it has evaporated. We feel it, but here are the numbers. Unemployment in the state of Vermont over the last 8 years has been historically low, to the point where there have, for the last 8 or 9 years, been fewer people to fill jobs than jobs are available. That is an economic reality that was put on steroids in the face of COVID. So what we're dealing with now is not only historically low unemployment, but impossibly low unemployment. Chittenden County is at 1.7% unemployment. Normal, healthy unemployment is 4%. So we are all struggling with the same issue, which is looking for qualified, wonderful people. In the care economy, this has been particularly difficult because what we have seen is that there's about 30,000 people in the state of Vermont who have literally left the employment market completely. They're not on unemployment. That's a common myth. These are people that are post-unemployment. These are people who have chosen to leave the work world, and they are people that I would normally hire and that you would normally hire. So you are not imagining the situation that you are in. I hope that sharing the numbers doesn't make you feel even worse. It's a bit of a reality check. This is real. And so the stress that you're experiencing is real. It's not a statement of how you run your business. It's a statement of an economic reality that we're all focusing on. The other piece that and this is me editorializing a little, that I think I've noticed is that those people in the care economy in particular are experiencing a level of burnout that is different than other occupations. I think part of this is that we are driven to care. That's a primary motivator for many of us. Before wages, before personal benefits, before any of those things, we need to know that there's meaning in our work. And in the world of COVID, what was originally feeling like a gift is now feeling like a sacrifice. And that mental shift is important for you to understand as an employer. So a lot of people are choosing to leave the care economy simply because it has now become overwhelming, not necessarily because of what we are doing or not doing as employers. That is our setting. And so here's how we get into some practical conversation about this. I don't, forgive me if I am mentioning ideas that are outside of the scope of possibility. I don't know where that line is particularly because I'm in a slightly different industry, but I'm going to throw some thoughts out there and maybe something will feel right. To build on both Lawrence and Erika, the goal here is creating a sense of stability and consistency among your staff, right? They want the same thing that they want to be able to provide for the kids. They need that for themselves, but they are very unlikely to engage in that conversation because they're so focused on the kids. So part of what your role to do as leaders is to start thinking about that consistency and stability conversation and engaging with your staff on that level. So there's lots of ways to think about how to divide up this money and invest it. Many of this, so I'm going back to Erika's slide on the development column, which is a really great column, that you kind of want to think about where you are with your staff. There are some things that you're going to want to do from an emergent perspective. How do I change the tone in my organization away from, oh my gosh, we're in a crisis, to something that feels a little bit more stable and safe? And then the next step is to think about development. So there's a process here that you can bring your staff along. One place that I worry for leaders in your industry is that you are trying to do and trying to plan and trying to create space for innovation all at the same time, which feels hard. So one thing that I wonder about, and this is a question really for Lawrence and Sherry probably, is whether some of that money can be used to invest in the benefit of experts. So for example, there are a lot of people who focus really clearly on innovative ideas in recruiting. I hate the thought of every single leader sitting in their chair at their desk right now, all repeating the same work when there's an economy of scale that y'all could benefit from, which is an expert saying, let me help you with this piece of recruitment, or let me teach you about this piece of recruitment. One of the values of the Chamber of Commerce, for example, is it really helps organizations, small organizations, have an economy of scale by benefiting from being part of a larger discussion. So wherever you can do that, so that you can free up your brain space, find a relationship with an expert to help you think things through. You cannot navigate the benefit scenario by yourself. You can't even compensation is a tiny bit tricky, right? So there are people in this community that are available and might be able to give you a little bit of that extra support so that you can kind of get a leg up. When you're thinking about benefits and how it relates to organizations, you want to think about, we tend to think about those traditional fringe benefits because that feels sort of hardwired, right? Medical and dental and short and long-term disability. And I saw retirement on Erika's list. Those are very useful to think about, but they may not necessarily even be in the emergent column. So when Erika said, talk to your staff, that is a wonderful, wonderful place to start, because those people are not only serving the care economy, they might be in the care, they might be receivers of the care economy. So they might be struggling with an issue that our staff is struggling with. And this is kind of interesting. Go back to compensation for a second. Everybody likes the idea of more money, but my guess is that some of your employees are benefiting from federal programs whereby if they receive more money, they're going to hit the economic cliff, which is going to make it less likely for them to be able to work. In other words, if I make more money, will I lose my housing subsidy? That's important. So as you have a conversation with your staff as a group, they can help you figure out what is important to them. What does stability mean to them? And how should it show up? It also really supports the idea of a collaborative work environment, which, you know, is kind of that space that also lends itself to some stability. So talking to your staff about what they might need might come up with ideas that are way different than what you actually thought. I will give you a couple of little examples here. We realized that to create a sense of stability, we have a lot of people here at Wake Robin that come from generational poverty. And so thinking about how they relate to work in a work system where they have to come to work, right? We're not all white collar employees in the world. A lot of us are driven by a particular schedule. If we don't show up, the organization is not going to function. Similar probably to the staff that you employ in the way that you need to run your business. So what we had to do is think about what that really meant to them. In those conversations, we came up with an emergency loan system. This is an easy thing to set up. It's a no questions asked. I don't care why you need this. You tell me you need this. This is the loan, and this is the way we pay it back. So no strings attached kind of support system. We also realized that people were having trouble with transportation. We're in Sheldon. So we took some of that available grant money that we had from a different source, and we created a matching grant where we cover 80 to 90% of small repairs for cars. So we grant people up to $1,500. What has been shocking to me is it takes about $500 on average for somebody to keep a car on the road. So that level of support that we were able to provide helped our employees come to work with reliable transportation and showed them that we are there when they need us to be. So two examples of benefits that you might not even have had thought of, but that come from your employees themselves. A couple of thoughts there. I think I would like to wrap up by encouraging you to the extent possible to help redirect your staff away from that feeling of crisis to a space of innovation. And you get there by having lots of conversations. One of those conversations is a thing that we actually here call a stay interview. It's a moment of time that we carve out with people routinely and periodically to basically say, how are you? What's getting in your way? And what can we do to resolve that? That's often attention we provide to new employees. And it's sometimes more attention that we provide only to people who aren't doing well, right? That energy gets sucked into the people who are poor performers. Give that attention to the people that are keeping you afloat, and just kind of keep touching base with them. The last thing that I would suggest is this is a really interesting opportunity for you folks. You are on the cutting edge of something really cool here. And to the extent that you have brain space, there are private employers that are eager to partner, eager to throw money at you. But our arrangement that we might need is different than the individual family member. So there are large organizations all trying to figure out how to crack the daycare nut, and we cannot do it. We don't have the infrastructure, we don't have the licensing, we don't have the expertise, but we desperately have the need. So look at where you're located, look at the employers around you, begin a dialogue. And that is only slightly related to these particular funds. But as you find that you are freed up because of the funds that you are given, that is a long-term strategy that I think is really what Vermont needs. And private employers are eager to have that conversation. We just don't know how to do it. So I didn't even know how much time I was given or how much I'm allowed, but that's all I have to say. Love to hear questions.
Thank you so much, Anne, and thank you to Lawrence, Erika, and Sherry as well. I would like to just open it up for Lawrence, Erika, and Sherry to respond to what Anne just said, and perhaps have a conversation about some of those excellent suggestions.
Well, I think the one theme you hear throughout this last 50 minutes or so is about how important this is about the people, right? And there just isn't anything that is more important in operating any business, especially a care business. And there is no substitute for having a direct communication and conversation with people when they're not rushed and when they're at their best, instead of when it's a crisis moment. And so I think Anne's comments about making sure you're intentional about that time, that's what really struck me, and how valuable that's been at different times in my career. I think there's also something that came up in the Q&A thread that I just want to touch on, which is this idea of what are we trying to do with this subsidy? And I want to observe that if this subsidy is what's necessary to break even, there's some fundamental work you need to do on your program. And you can't just use this to cover operating deficits and deficiencies and hope it's going to be different a year from now. This is the time to make some changes, to get some help in making those transformation changes. The money itself isn't what creates that opportunity. The money helps facilitate the opportunity to spend that time.
I just wanted to comment, Anne, I really appreciate what you said around creating security and stability, because during a period of time where life feels anything but secure and stable, I think looking at how you can meet your basic needs, not necessarily through wages, but by providing opportunities to keep people feeling safe and secure is so helpful. And I also love, Anne, your recognition that sometimes what people need, we may not know. And so asking good questions and listening carefully and saying, what do you need so you can feel like you can do your best work? What do you need to make it easier for you to come to work each day? What do you need so that you feel like you can focus both on coming to work and also on the important things you have in life outside of work? Just starting a dialogue with your team to understand what are those small things that would make a big difference is such a great place to start. And so, Annie, I think your practical stories just brought it all home.
One of the most interesting answers to that question I received several years ago when I was working in a primary hospital, and we were trying really hard to recruit per diem nurses, not unlike now, actually. What would happen is the nurses would work and then quit, and then work and then quit. And when we asked the question, what was behind that, the answer was, I got to be home and take care of my house. So I want to work for a while, but then I need to go. And the benefit that came from that is that we signed people up for bi-weekly home cleaning service. And that weird little benefit not only was so fun and so unusual that it ended up evening out our retention issue. It was the craziest little thing. So you just never know what people are going to suggest.
Hey, Brenda, I saw in the questions, someone had expressed gratitude for the funding and also commented, though, in order to increase wages, that they would also need to do a tuition increase. And I think the answer to that is yes, probably. I think what Lawrence has talked about is that this, it's about your entire business structure. And, that is necessary. I think we all know there's a staffing crisis across Vermont in many sectors, and particularly in the caregiving sector for sure. So pay is important. And if these funds can help you with your tuitions, raise them more incrementally rather than dramatically, that's a benefit not only to your staff, but also to families. That gives them a little, more time to experience those increases.
Thank you. I want to just acknowledge too that I really appreciated, Anne, when you said, sort of bring in the experts, like the benefit of experts. And we have the benefit of the expertise of everyone presenting today. And I understand that, business mentors, business coaches, wellness coaches, et cetera, are also some of the other potential benefits that are on folks' minds. And so I'm thinking let's start thinking right now about how we might be able to support that. And I don't know yet. And so the answer, or to the question in the question box, I'm not typing in an answer because that is like under real-time development, I would say. One of the things that I can say is that this conversation has been recorded, and recording, as always, along with the slide deck, will be posted on the Let's Grow Kids website. So we have a website, but we also have a webinar page, and it'll be on our webinar page. So that's at letsgrowkids.org. And, some of the questions that you raised, I know, will be addressed when the CDD expands their FAQ list, and other questions that you have we'll continue to learn together. And so we anticipate talking with you again in January, after you've had a couple of months to sort of develop and implement and sort of think more about how you're going to use these ARPA funds to benefit your program. So in the meantime, you have shared services as a resource. You have some of you already have access to Vermont's Employee Assistance Program, InvestEAP. If you're a member of an early childhood network, those are resources available to you already. And we are putting together at Let's Grow Kids and Vermont AEYC a packet of more resources. So some of those will be like links to sites. Some of those I know one of the things we've been looking into is like a healthcare navigator, because as Anne said, if you're looking at healthcare benefits, and you haven't offered those before, it can be really tricky to navigate. And not only, it's not only a sort of a, do I have the time to navigate, but even understand and unpack what you're looking at. And so there are healthcare navigators, and we'll see, what would work for Vermont. So there are a number of initiatives being developed as we talk, and we will gather your questions. We'll put them out to this group of panelists, and we will post them. And someone said, when will it be posted? So the Vermont, and yesterday we were together, some of us, for the Vermont Department of Health webinar that was already posted, and I anticipate that this one will also be posted within 24 hours. So thanks again, Sherry. And
hey, Brenda,
yes,
I just wanted, there was one thing that I didn't mention. I also wanted to mention that when I was comparing ARPA and CURSA, I didn't mention that the ARPA funding does not require monthly reporting. I think, Lawrence did touch on that, in that you don't have to spend it monthly. You can accumulate it, and if you needed it for a larger investment, that sort of thing, during that grant period of time, or that benefit period of time. But I also just wanted to mention that there is no monthly reporting. And so when we talk, or requirement to spend it. So when we talk about a follow-up session in January, when people have had a chance to apply, know what they're getting, it may, there may be, just a slightly different bend on the conversation when there's more clarity, and it might be a great opportunity for some sharing among programs about what they've decided are the investments that they see is going to help fiscally stabilize their program into the future.
Yes, thank you. Excellent point. So in the meantime, I see it's time for us to wrap it up and say goodbye. But please do reach out to us at Let's Grow Kids, also to Vermont Association for the Education of Young Children. And we hope to reconvene in January, and I will let you go. Get back to the kids. Have a beautiful afternoon. Thanks, everyone.